Okay.
Very good. I'll give you a point. And go ahead.
I'm Raymond Cohlmia. I'm Dean of the University of Oklahoma College of Dentistry.
Great. Well, Dean Cohlmia, tell me what happened May 1st for the dental profession in Oklahoma.
Well, it all occurred kind of unique. The Board of Dentistry issued a mandate that all dental office operations are suspended with the exception of emergent care only. So that basically shut down the majority of the dental office operations for the entire month of April.
Okay, so that was the beginning of April that occurred.
Yes,
And
ma'am.
then-
Friday, April 3rd.
And then, but you were still during the last almost 2 months. You've been seeing urgent. Is that right?
Yes,
So-
ma'am. We never actually closed down for emergency care. Care that people need if they're in pain, care that if they needed treatment, that if we didn't do anything about it, could turn into a worse situation. That's what we continue to treat. So we were open for those operations through the oral and maxillofacial surgery department at the university. And most professional offices were open for emergent care as necessary.
Okay. And then May 1st, last Friday.
We began our operations. It started to ramp up again and open the operations, and all dental services are available right now, from cleaning to routine care. Obviously, we're trying to complete some care that was in the midst of being done over this last several weeks, and so we're bringing people back in. But your offices are open for full care at this time.
Well, tell me about that, about the people that have been with a partial or whatever for the last month or so.
Right. People that we were in the process of, say, delivering dentures or partials or even crowns, some of those had to be suspended, and we have quite a few of those procedures in process right now. So we're bringing people back in right now to finish those procedures. Sometimes we had to finish those procedures, obviously, during this time, but most of them are coming back in right now to complete all these procedures.
And so that was May 1st. You started, I guess, Monday.
This last Friday. And
Did
so
you
this Monday was May 4th.
And that was the first day you actually started?
We actually started operations on Monday, May 4th.
Okay,
Yes,
and
ma'am.
so has the phone been ringing off the hook? What, are people
It's been
afraid to come
busy.
in, or they're-
The demand's there. Of course, we're running at roughly a 40% capacity right now. Social distancing and spacing of our patients is critical, as it is on the outside with the professional offices. So we can't just stack all the patients in there. We're usually seeing one patient completely. That patient's being dismissed. We're going to the next one. For example, in our particular college, we have one floor that has 108 dental chairs. We're only running 45 of those chairs right now to keep the spacing apart, to keep the social distancing, to keep faculty, staff, residents, students, and of course the patients safe. On the outside, they're doing the same thing. They're just limiting the patients on a scheduled process, seeing those patients, putting the full PPE or personal protective equipment on that both protects the patient and the staff and the faculty and the dentist. That's being done on a scheduled basis. So the services are available. They're just not seeing as many patients as they normally would throughout the day.
Explain to us why a dental patient it's more risky for a dental patient. I'm not saying this very eloquently, but talk about the safety measures, why you have to be so extreme on your safety measures for your safety and for the patient's safety, and explain how it's aerosolized when they open their mouth.
The majority of dental procedures are aerosol based, meaning that a mist or a form of water is created during that procedure, and when a patient exhales, that mist is thrown into the atmosphere, sometimes up to 10 to 20 feet. So that's the actual problem when we're doing the dentistry treating. So we have to have the full protective equipment to guard against that mist or that aerosol-based procedure. If it's a non-aerosol-based procedure, that's not a problem. But for example, when we're doing a filling on a patient, that's an aerosol-based procedure. Most of the time we keep the aerosol very well contained. But if the patient happens to exhale at that time, when that aerosol is being generated, that's going to be put into the atmosphere in a certain radius around that particular chair. That's the danger. That's the danger, is the aerosol-based procedure. In the field of dentistry, we use what's called universal precautions. And universal precautions is what every professional caretaker does, in the fact that we assume that everybody is contagious. We assume that, and then we have to protect for that. So that's why we're not testing every one of our patients individually. So we just assume that that's a possibility exists. Therefore, we protect both the patient and the practitioner with the personal protective equipment to mitigate that CV-19 or any other responses too. Another common thing is tuberculosis, is HIV. There's tons of viruses out there that we protect for, but the CV-19 has a little bit different characteristics that make that aerosol much more dangerous. So because of that, we're mitigating those responses by putting the most amount of PPE on each of us. Dentistry has those aerosol generated procedures. That's the difference between us and the medical profession. Plus the fact when we provide dental care, we're usually within 18 to 20 inches of those patients. You know, and as you know, when you've heard on the CDC, when you talk about somebody sneezing, it can go 8, 10, 15 feet out. Well, we're within that 20 inches zone. So if something like that were to occur, then we'd all be exposed.
So talk us through the process, all the PPE you're putting on, all of the safety measures. You're starting the day, you're going to have your first patient. Talk me through what that looks like.
Okay, when the patient checks in, well, let's just use our facility for example, the University of Oklahoma College of Dentistry. The patient checks in, they're issued a mask immediately. They go through a series of questions. We take their temperature. If everything's fine, they're taken to the clinic and they're put in the chair at that point. Then at that point, prior to that patient getting there, we're ready to go. The chair has been completely sterilized, all the equipment, everything is totally clean and ready to go. The person then has to don, and it takes about 2.5 minutes to really put all the equipment on. So they would start, they'd have to have an N95 mask on, then a surgical mask on top of that. They'd have to have their loops or their eye protective wear, a face shield, they'd have a head bonnet on, they'd have a gown on, they'd have booties on, and of course, gloves on. So we've got several things to put on to be prepared to treat the patient. So that's what we actually have to do, in fact. So now when the patient or the procedure is done, then we have to take all of that off, and that all goes into the biohazard waste at that point. So there's a lot more steps involved behind the scenes, and of course when the patient's dismissed, it takes 15 to 20 minutes to disinfect the entire place to make sure that we are totally ready to go for the next patient. Again, we haven't had a single issue of CV-19, and we've maintained that protocol to the highest level of standard here, as all the other professional offices on the outside. So we haven't had an issue with that at all. Know that their safety is fully protected when they come to the profession and seek professional dental care.
What if a patient came in? You said you're taking their temperature. What if it was sort of sketchy? I mean,
100.4. When the temperature is a little high, we would actually ask the patient to go through a couple of series of questions and most likely reschedule the patient at that time. We recommend that the patient go back home and wait. There are reasons why a patient temperature may go up. I've had a patient where they're 100 degrees and then 2 hours later they're back to normal. Things occur, but we just try to make sure. And again, temperature is not a full indication manner. I believe that our dean of College of Medicine once told me a few weeks ago that only takes up 38% of the patients, but at least we're gaining 38% of the patients. We're just looking at any information that we could possibly lead us at the patient that it may not be best to treat the patient today.
And are you allowing them, I mean, obviously you have a lot of pediatric patients, so they come with a visitor. Is that visitor screen?
We have a visitor policy now in place, and I think most offices on the outside, if you accompany a patient, then most likely you'll be waiting in the car. The adult patients we prefer to see on one-on-one basis. We don't have a waiting area, reception area right now, so we just want the patient in there. But there are certain procedures. For example, a surgical procedure, you have to be accompanied by an additional person. If a surgical or an anesthesia procedure was done, they can't drive home, they have to be accompanied. Or also, as you said, pediatric patients or kids, their parents or guardians have to be with the child at that time of treatment. And then we actually take the same measure there. They both have to wear masks when they come in the building. They both go through the screening process, again, to mitigate the processes of CV-19. So we do allow some exceptions to the visitor policy, but as a general rule, it's just that only patient that would be in the college at any given time.
And they mentioned something interesting about the anesthesia. Then, so you've got more than, you don't just have a dentist sitting in this building, a singular dentist. You've got the dental hygienist. You've got also residents, correctly?
Correct.
Okay.
We have several residency programs from oral surgery, orthodontics, periodontics, an advanced residency program, a general practice residency. Those are all doctors that are doing additional training at this time. Plus we have all the dental students in our operations. And then we have dental hygiene students that are in our operation along with faculty, staff. So the building can get to be quite full. It's kind of unique when this whole situation, we averaged 800 to 1,000 people in the building at a given time on an average basis. And all of a sudden within 3 or 4 weeks, we're down to 15 or 20 people in the building, just core essential personnel, and everybody's telecommuting from home. So we have everybody fully protected, which is why there's a lot more demand of PPE for our operations just to cover everything. We're basically, in our college, we have 256 dental chairs. So all of those chairs are used pretty consistently throughout the time to serve patients and serve people of Oklahoma.
Wow. So what is it looking like right now? What are patients calling in for right now? I mean, you've got a lot of catching up to do. People that you said you've had things that were created for them. They need to come in and get those. What is catching up looking like right now?
Well, right now, when patients call in, we have to kind of rank where their needs are. If it's a routine care procedure, they're probably not going to be seen for a week or two, because what we're trying to do is get all those patients in, one that are emergencies, one that are in pain that need immediate care. Secondly, those that are in continual care that we need to finish up their treatment, try to get these processes, they've been waiting for quite some time. And then third, the people for routine care. So if a patient calls and says, well, I had a feeling it needed to be done, well, that's probably going to be a couple weeks before we get to that, because that's not an urgent procedure. Patient calls in and says, I've got a large abscess, I need help right now. They're seen immediately right there on the spot. Patient calls in, or we contact a patient and says, I've been kind of waiting for my denture or my partial or my procedure to be finished up. They're kind of moved up to the priority list too. So we have a ranking system that we're doing. So as we're getting back going again, we've got to rank these procedures, because we can't handle everybody at one time right now. The demand's too high. But we're going to start providing, for example, we're starting hygiene care next week. Not this week, because we're trying to get all these chairs occupied with getting all this clinical work that has been done before just completed. But we're starting regular hygiene full operations next week at about 50% capacity, because of the social distancing and spacing that has to occur between the patients.
What are the plans for? You've got also residents more next week and that kind of thing, or just kind of wait and see?
April, well, you know, that depends upon where we are, as far as we have to make sure, and the University of Oklahoma has been the lead in determining the CV-19, and I have all the exceptional experts here on campus to provide me the best information for the future. So if the social distancing and the parameters kind of stay in place, we can only increase that percentage to so much. I mean, it doesn't mean, if we weren't going to maintain that percentage of spacing between patients, I simply can't go to any higher percentage. I won't be back to 100% operation for quite some time, at least through the end of July, I would suspect. However, what I can do, and what we're doing at the college and many offices are doing, is we're opening up a little early. We're going through lunch, and we're going through the evening processes to manage that. So we can increase our percentages by spreading out our appointments and covering more of the daytime. So instead of being the traditional 8 to 5 operation, we may be a 7 to 6 operation running throughout the time. So we can accommodate more people. So that will get us up maybe 15 to 20% more. So we'll be running probably 75 to 80% capacity if we use those expanded hours and opportunistic times. We're even talking about using evening clinics. That's how we're going to make up the time. And then we'll just have to reevaluate in June, July, and see where we are. Again, I have the greatest experts in the world sitting right here at the University of Oklahoma. I'm going to call upon them to say, where do I need to be? We don't want that bubble to occur again. We don't want an outbreak to occur again. But our hopes is that by the fall semester, we're back to relatively normal processes. With the exception, we're still going to be using that same PPE. Please know that this new format of delivery of care, that's probably going to be the normal standard of care. That shouldn't alarm people. My father, one of the greatest people in the world, 91, talked about that, and he even laughed. He said, Raymond, we've done this several times. You see, he started the practice of dentistry wearing nothing, and then they had to wear gloves, and at that time, gloves were $30 and $40 for a box, and they had to start wearing gloves, and he says, well, what's next? Then they had to start wearing eyewear. Then they had to start wearing masks, and he said, you know, Raymond, when I retired at 85 years old, I was wearing gloves, eyewear, and a mask. He said, this is just the next stage. He said, so this is going to become the norm of how we deliver dental care. I don't see an issue with that at all. We continue to progress, we continue to get better, and of course I'm hoping that the cost of those supplies come down dramatically, because right now those costs of those supplies are pretty high. So I really think that dentistry is going to be just fine. We're going to do fantastic. I'm excited for the future. It's an opportunity ever before. Serving people is one of the greatest things. Dentistry still is one of those one-on-one personal experiences in the world of healthcare right now. We get to know our people across the board. When I was in practice, it was my biggest joy when I had the grandmother, the mother, and the daughter all in my practice, 3 generations. So dentistry is going to be just fine. But people need to know that they're going to be safe, that they're going to be well taken care of, they're going to be protected, and we're going to be there for them when they need them. The University of Oklahoma College of Dentistry, we're there, along with all the offices to serve their needs whenever they need us.
As we get, I'm thinking that the summer maybe is a busy time for routine dental visits.
It's
because,
very
you know,
busy.
Parents wait till the summer to take their kids and.
There's a rule of thumb that we use in dentistry as a general rule. When people are working, we're off. When people aren't working, we're on. And so summertime is a very busy time for us, especially in pediatric. Why? Because the kids are normally out of school at this time. People have a little more free time in the summer. So our summer is some of our biggest time to get things done. August is also a big time, right before school. So we'll be available at those times. I'm expecting a pretty good sized summer, and we can always expand our hours to accommodate the needs. We're not going to turn people away. We're not going to turn people away. In the early stages, we're going to rank people as their needs arise, but I hope by June, July, we're at relatively normal operations. You call in, you need help, we're there for you. We expand our hours to manage that. But summertime is traditionally a little bit higher of a time frame, along with the Christmas time, December time. Any time that people are out, that kids are out of the operation, is when you can expect to peak a little higher in dentistry.
All right, well, so as we're moving ahead and you're confident that you've got some safety measures in effect that will protect you and your patients, and what do you think, how does dentistry look for the future?
Dentistry looks bright for the future. We always have had, as so many people have told me, dentistry is replete with turning points. Well, this is a turning point in dentistry. Well, there's tons of turning points in dentistry. Dentistry has the most brightest future of all. We change people's lives in minutes. There's nothing more incredible when you restore a patient's smile and they get up and they're crying and they're saying, thank you for restoring this. So we're not going anywhere. We're there to serve the people. You know, dentistry is a critical part of medicine. We're a part of OU Medicine. We're a part of this team and this campus. It's a part of the healthcare. We're more thinking along the lines of wellness. You know, dentistry over the years has done an incredible job of teaching wellness. You know, for years, we went to our medical people when we were sick, but you always went to your dentist twice a year because we ingrained that in people. Preventive maintenance and wellness is what ensures the future. Dentistry's future is incredibly bright right now. The techniques that we're developing to restore people's smiles, the computerization, the integration of these advanced technological procedures are absolutely incredible. And dentistry is relatively painless procedure compared to years and years and years ago. Most of the time, actually, I'm going to get some dental work next week, and you know, I usually fall asleep during appointments. It's just how it is. It's the only time that I get to rest, so to speak. But dentistry's bright. The future's bright. We've had the highest number of applicants for the last many years we've ever had before. People are seeking out dentistry left and right, both dental and dental hygiene. I'm excited about the future, and I'm excited to continue to provide all of these services to these people.
That is a great place to end. Anything else? Feels good. That was good.
We are clear.
Oh, that was so inspirational.